Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Gallbladder.
Hello guys. Let's discuss about a medical problem called cholangitis. Cholangitis is the inflammation of the bile ducts. Bile ducts are the tubes that carry bile from the liver to the gallbladder and small intestine. Bile is a fluid produced by the liver that aids in the digestion of fats. Let's discuss the pathology behind cholangitis. Cholangitis can occur when the bile ducts become blocked, usually due to a bacterial infection. This blockage can lead to a buildup of bile in the bile ducts, causing inflammation and infection. Common causes of cholangitis include 1. Gallstones. 2. Strictures, that is narrowing of the bile ducts, and 3. Tumors. Symptoms that the patient might present with include 1. Abdominal pain, particularly in the upper right side. 2. Jaundice, which is yellowing of the skin and eyes. 3. Fever and chills. 4. Dark-colored urine. 5. Pale-colored stools. 6. Nausea and vomiting. Diagnosing cholangitis typically involves a combination of medical history, physical examination, and various diagnostic tests, like 1. Complete cell count, to see infection count. 2. Liver function test, that will show raised bilirubin levels and SGPT. 3. Alkaline phosphatase, that will be raised. 3. Gamma GT, that will be raised. 4. Blood cultures may be performed to identify the specific bacteria causing the infection. 5. Ultrasound upper abdomen, or whole abdomen. 6. CT scan abdomen, which can help identify the cause and extent of the blockage. 7. ERCP, that is endoscopic retrograde cholangiopancreatography, in which a flexible tube called endoscope is passed through the mouth and into the small intestine to inject contrast dye into the bile ducts. X-rays are then taken to visualize any blockages or abnormalities. 8. MRCP, that is magnetic resonance cholangiopancreatography, which is a non-invasive imaging technique that uses MRI to visualize the bile ducts and pancreatic duct. 9. Percutaneous transhepatic cholangiography, in which a contrast dye is injected directly into the bile ducts through the skin, guided by imaging techniques like fluoroscopy. Treatment of cholangitis include 1. Antibiotics, which are typically prescribed to treat the bacterial infection. 2. Painkillers are given to control severity of pain. 3. Antiemetics are prescribed for nausea and vomiting. 4. Intravenous fluids are usually required, especially in cases where the patient is volume depleted. 5. Other interventions are required to address the underlying cause, such as removal of gallstones or tumors or drainage of bile. These procedures include 1. ERCP, in which a flexible tube is passed through the mouth and into the small intestine to remove or bypass the blockage. 2. Percutaneous transhepatic cholangiography, in which a thin needle is inserted through the skin into the bile ducts, to drain bile and relieve the blockage. Severe cases of cholangitis can lead to complications, such as 1. Liver damage. 2. Sepsis, and 3. Organ failure. Preventive measures may be recommended, especially if gallstones are identified as a contributing factor. This may involve dietary changes and medications to prevent the formation of new stones, and in cases of multiple gallstones, gallbladder removal is advised. In very rare and severe cases where cholangitis leads to significant liver damage and failure, a liver transplant may be considered. It must be noted that in case where you have developed any of the discussed symptoms, especially right-sided severe pain, yellow discoloration of skin, nausea and vomiting, and fever, and you suspect you might have cholangitis or any other medical condition like gallstone, it's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. If you have any questions or query, please leave us a comment.
Subscribe to my channel at YouTube at Gallbladder and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.